Hello everyone, this is Dr. Demchenko with you, and today we will talk about muscle tone. This is a very big and interesting topic because you can notice that in many of our videos we recommend relaxing a certain muscle, releasing a trigger point, or stretching. And we constantly try to relax our muscles, but there hasn't been a single video where we could discuss why these spasms appear in the first place, where they come from, how you can actually relax muscles, why we need to do it, and how to do it in the most effective way. Let's go. So first, a little theory. Where does muscle tone come from? Muscles are practically like a motor. And what does the motor need to work? It needs to receive a command to work and get the fuel it runs on. It's electricity or gasoline or gas, something that gives it the ability to produce mechanical force. In fact, the command comes from the brain through wires, which are the nerves that transmit the signal to either make the muscles work or not work, and in what mode to do it. And the fuel consists of substances delivered by the blood. In fact, it's oxygen and nutrients. Muscles can work in several modes. First of all, muscles have a basic tone. This is the level of tension the muscle maintains even when you are completely relaxed. This basic tone is necessary to support internal organs for the normal functioning of joints and to prevent muscles from atrophying. Now, basically, the state when there is no basic muscle tone can be seen in a person under deep anesthesia. By the way, I have quite a few patients who had severe back pain, even with herniated disc affecting the leg, and they ended up having some kind of surgery that wasn't related to the musculoskeletal system at all. They were given deep anesthesia, and after coming out of anesthesia, their problem was gone as if it had never existed. Why? Because it is precisely under the condition of deep anesthesia that we lose all muscle tone, and accordingly, all spasms relax. These cases are common in my practice. But if a person is conscious, then even if he is sleeping, he still has a certain level of this basic muscle tone. Further, according to their tone, muscles can be divided into phasic muscles, that is, the muscles we use to make movements, and postural muscles, which help us maintain our position in space. These are the muscles that mainly do not move us, but hold us in place. And here they work a little differently. In postural muscles, the tone is generally quite high, and it's fairly constant because we only need to change the level of tone in these muscles when we are lying down or standing. That is, as soon as we become vertical, all these postural muscles need to maintain this constant tone, which changes slightly but doesn't make any sudden jumps. Because if the postural muscles make sudden jumps, we will either fall or be bent out of shape and we won't be able to move. Therefore, this musculature should mostly be in a generally good active tone with only slight fluctuations. In the phasic, that is in the motor musculature, everything is a bit the opposite. Yes, there is always a slight basic tone, but mainly these muscles are needed so that they work with rather large amplitudes. The difference in power, in contraction, for example, the biceps, that is, when you are sitting, it is slightly tense, but quite relaxed. If you pick up some heavy object and start lifting it, the muscle sharply increases that very tone. And in order to increase this tone, a signal goes from the brain through the spinal cord, passes through the roots into the peripheral nerve, and activates the muscle as much as necessary. Muscle tone control is complex, influenced by various factors beyond direct brain signals. For example, electrolytes like potassium and magnesium are used up during muscle contraction and relaxation. And you've probably heard that you should drink isotonic drinks during intense sports activities, especially when you sweat a lot, and that you can relax your muscles by taking magnesium, because it is better absorbed with B6, or by taking a bath with Epsom salt, which is actually magnesium salt for baths, or by rubbing yourself with special magnesium oil, that is a massage oil with a high magnesium content directly onto tense muscles. And this can be quite effective in relaxing them if you are overtrained. Or, for example, the weather outside. The colder it is in the environment, the more our muscles become shorter, tighter, and less elastic. Therefore, that's why in yoga, they even came up with something like hot yoga or Bikram yoga, when people practice yoga in hot, heated rooms and achieve much better stretching results in these warmer environments. Also, receptors located in the tendons, that is, in the connective tissue elements by which muscles are attached to bones, play a very important role in regulating muscle tone. In these places, there are a lot of specific receptors that, in response to stretching, compression, or other mechanical influences, can change muscle tone. Motor cortex of the brain, that is where our movement is generated. It will also be able to send very effective relaxing, that is, inhibitory relaxing signals to the muscle tone. Quite often, especially with age, we will see a situation that Thomas Hanna described as neurosensory amnesia. That is, when a person moves very little, performs movements with little awareness, does little sports or yoga, and tries to feel their body. So, a situation arises where the body map, that is, the sensation and perception of our body by the brain, specifically the cerebral cortex, deteriorates. And this condition, called neurosensory amnesia, will lead to deeper subcortical layers of the brain taking over control of muscle tone, and that tone will also increase. If you're interested, read more about this topic. There is a wonderful book by Thomas Hanna called The Myth of Aging, or The Art of Not Getting Old. I highly recommend it to you. It's an entire book about neurosensory amnesia. And in addition to all this, our psychological state has a very strong influence on muscle tone. That's actually why muscle tone becomes higher than normal and starts to bother us. Let's also start by sections. One brain is neurosensory amnesia, which we've already discussed with you. These are such disorders of the cerebral cortex as a stroke or cerebral palsy in children. There you can see a very high increase in tone, yes, of the central type, when a person actually can't even overcome the tone of the flexor muscles. If the cortex is functioning normally, not severely damaged, and for example, there is a phenomenon of neurosensory amnesia, then these are reversible processes, but they also depend specifically on the cerebral cortex. Further problems with muscle tone can also occur due to issues with peripheral nerves, that is, those that are not located in the head, but rather in the form of the spinal cord in the spinal cord itself. Or they already exit from the spinal cord and travel through the body to each muscle. For example, if the nerves that exit from the spine or travel through the soft tissues become slightly compressed. That is, there is compression of the nerve, but it's not severe. So the first stage of such nerve compression will be characterized by nerve irritation. And when there is nerve irritation, the muscles become very tense, meaning a reflex muscle spasm occurs. This happens because there is slight compression, so to speak, which is also called subclinical nerve compression. In this case, the whole muscle becomes very painful, shortened, and tight. Moreover, if, for example, the nerve is compressed more strongly, then at the next stage there will already be pain. And if the nerve is compressed even more, then the opposite happens. Instead of high muscle tone, we will see a collapse of muscle tone, the so-called paresis or even paralysis. That is, when the muscle stops responding to signals from the brain. The next cause could be problems in the joints. Accordingly, if a person has problems in the joints of the limbs or the spine of an inflammatory nature or traumatic or rather pronounced arthrosis, then muscle tone can also be reflexive and have a protective character, the so-called muscle defense or MD. Spasm of muscle defense. That is, when we have a problem in a certain region, for example, there may be inflammation of the knee. Also, these can be problems with internal organs, so the muscles that are nearby tense up and provide protection for this area. If the problem is with an internal organ, often there is an acute situation when the abdomen becomes board-like, painful, and you basically can't touch it anywhere. If the problem is with the joints, it doesn't necessarily have to be acute. For example, with arthrosis, although it would seem that arthrosis is not an inflammatory disease, there's still a small level of inflammation present with arthrosis. And this is what we call a slow-moving process. Chronic inflammation in cases of arthrosis of the hip joint or knee joint will also cause constant muscle tension around these joints. We can also observe protective spasms in the lumbar or cervical regions of the spine due to functional instability, that is, the inability of the deep spinal muscles and the ligamentous apparatus to function properly, to keep us in a normal vertical position. Then the larger phasic motor muscles will also go into reflex spasm to protect these regions. And we move even closer to the muscle itself. So you notice that muscle tone will be influenced by the brain, the spinal cord, peripheral nerves, joints, and the spine from an orthopedic point of view. And only now do we come to the causes that are already located within the muscle itself. And most often, this is the formation of trigger points, that is, such pathological spasms in the muscles, which most often occur when the muscle is not doing its own job or is working at a volume it cannot handle. Even Avicenna once said that weak muscles tend to spasm. Very often, patients come to me and say, I have spasm muscles, how can I go work out at the gym if everything is already tight? And indeed, at first, strong spasms and trigger points should be eliminated before starting to work out the muscles. But when you work out at the gym, your muscles become stronger and actually they will be much less tight. Because it is exactly the weak muscles which cannot handle the task in front of them that will go into spasm. Actually, if you palpate big, strong bodybuilders, their muscles are quite firm but soft. They don't have any trigger points or strong reflex spasms. So if a muscle is working in poor conditions for it, a kind of super spasm can develop in the muscle, which will also shorten the muscle. It can cause a general increase in muscle tone, disrupt its function, and cause pain both in the muscle itself and referred pain. We talk about such referred pain quite often. Well, for example, in the video about how to get rid of a headache in 5 minutes using a marker, in this video I show exactly how to relax the trigger points that appear in the phasic motor muscles of the neck, because we very often use these muscles in a static mode. What does that mean? We have deep neck muscles that are supposed to hold our head and neck in the correct position. But when these muscles are underactive and the head position is not optimal, the muscles that are supposed to lift the head, turn the head, and tilt it to the side start trying to hold it up instead. This is an abnormal load for the physical muscles, and it is precisely in these muscles, due to improper overload and incorrect functioning, that those very trigger points develop, the ones that cause headaches and that we relieve with the help of markers. And now let's discuss methods for working with different types of muscle tone. That basically with the marker we perform the simplest action, which is specifically aimed at relaxing the particular muscle directly. And this only works with muscles that have a local type of hypertonus, meaning it's localized, caused by overuse, and associated with trigger points. And actually, you already understand that there are quite a few types of hypertonus, and that's why when you see some video where they relax muscles using a marker, you take a marker, press it against the muscle, it hurts a lot, but nothing happens. The muscle doesn't relax. That doesn't mean the marker didn't work. The thing is, you just have a different type of muscle tone. And it's very possible that you don't have a trigger point in the muscle, but, for example, instability in the cervical spine. The instability in your cervical region has caused your long neck muscles to become overstrained due to the vertebrae not holding well. There are no trigger points in them, but they are very tense, and this can also cause headaches. And a marker won't help here. What you need here are exercises to stabilize the cervical region. That is, when our deep muscles take over the work, the superficial ones will relax on their own without any massage. So, how does pressing on a muscle with a marker work? This is the most direct effect on the trigger point. The spasm that is located in the trigger point is actually an active process. That is, we are constantly spending energy to maintain this super spasm in the muscle. If a person is put under deep anesthesia, again, all these trigger points also relax, like all other spasms in the muscles, because the signal going to the muscle is interrupted. And this is that super spasm. Since it constantly spends energy and requires it, you can relax it by interrupting the supply of energy as fuel, basically to this motor. For this, we actually use a method called ischemic compression. That is, we interrupt the blood flow at this point, stopping the blood flow and accordingly the supply of oxygen and nutrients. The motor simply can't work any further, and in this emergency mode it shuts down. The muscle relaxes. How do we achieve this? In order to relax almost any trigger point, you first need to find it, press it firmly, usually against the bone, so that there is a solid support. And do not move your fingers there or a stick or something like a massage ball. It is very important not to move, because if you start moving, blood returns to the trigger point and everything starts over again. So we just press, block the vessels, and this creates ischemia, which means oxygen starvation of the tissues. Since these are tense tissues, they have a problem with energy deficiency to maintain the spasm, and reflexively, automatically, the spasm relaxes. This is a pretty simple way to relax any muscle. It takes about 40 seconds of pressure on the point. There are always 3 stages. The first is very intense pain, then the pain levels off onto a plateau. And there can be radiating sensations, meaning some painful feelings in other places. Then all this pain will start to concentrate at the point, relax, pulse, and then fade away. In fact, this is the simplest mechanism of muscle relaxation. The second way to work with muscle tone is massage. When I was still studying at the institute and attending massage courses, I was such an active, strong athlete, and I liked sports massage. And I sincerely thought that we should really knead the muscles, we should knead them, stretch them. But even then, our teacher said that during massage, we are not working with the muscles. We work with the nervous system, with the receptors that are located in the skin, tendons, and fascia. And at that time, it seemed very strange to me, but now I perfectly understand that when we work with massage, it is work with the receptors. And in fact, when there are stroking movements, tapping movements, it's simply the stimulation of different types of receptors. Exactly the same mechanism will be at work with kinesiotaping. That is, when we apply a plaster to the projection of a certain muscle, move a little, and the muscle relaxes, this is also not working directly with the muscle, it's reflex therapy. Because the tape stimulates skin receptors, which in turn through the cutaneous muscular reflex, that is the skin muscle reflex. It's like when you tap your leg with a hammer and your leg jerks. The same thing happens when you apply tape to the skin over a muscle and the muscle relaxes. The Swedish massage will work through the same mechanism. So basically, when we use massage movements on the skin, we're working on the skin receptors, tendon receptors, and fascia receptors. This sends certain impulses to the nervous system, and then the nervous system relaxes the muscle. So when you give a massage to others or do self-massage, remember that we're mainly affecting the receptors, not trying to knead the muscle directly. The next method for reducing muscle tone is stretching. There's a well-known mechanism. If you do a static stretch for about 40 seconds, a reflex signaling also occurs in the tendons, which reduces muscle tone. In recent years, the scientific community has been saying that this is not the best way to reduce muscle tone in the muscles. And the hold-release method, or the tension relaxation technique, works much better. It is also often described here as the phenomenon of post-isometric muscle relaxation. This is also a neurological phenomenon. What does it consist of? Well, for example, I'll show it for the biceps. If you start contracting your biceps, your arm will bend at the elbow joint. If you don't let your arm move, but start contracting the muscle will start working, but your elbow won't bend. The second mode of operation is called isometric. If you hold it for 8 to 10 seconds and then relax, the muscle will go into a fairly deep relaxation. This is a neurological phenomenon, which is also called hold-release or post-isometric relaxation. The next is myofascial release using myofascial rollers and balls. When you work with myofascial rollers and balls, you are actually combining 2 mechanisms. The first mechanism is when you stop at a tight spot and wait for it to relax. This is ischemic compression. And when you roll a roller over the surface of the skin, especially with a roller that has such protrusions, dots, or spikes, In fact, you are actively stimulating the skin and fascia and their receptors. And it is precisely through the stimulation of these receptors that you will be working with muscle tone. Therefore, here it is convenient that we can simultaneously distinguish two mechanisms of muscle relaxation. The following techniques are related to arthrogenic tone, that is, tone caused by the joint, or tone that comes from the attachments of tendons and muscles. With arthrogenic tone, the most effective approach will be working with manual therapy to develop joint mechanics and therapeutic exercise to improve joint biomechanics. If the joint moves correctly, there will be less friction in it, less inflammation, and accordingly, less arthrogenic tone. If we are talking about tone related to tendon problems and tendon attachment issues, then shockwave therapy or needles will be the most effective for stimulating these receptors. As I already mentioned, if a nerve is slightly compressed somewhere and doesn't glide well through the tissues, it will also become irritated and irritate the muscles it innervates. Also, if a nerve is compressed and doesn't glide well, the muscles can increase their tone to protect the nerve, since muscles stretch much better than nerve tissue. And for example, when you make this kind of movement with your hand, the nerve, since it practically doesn't stretch, has to glide through the tissues. If the nerve is severely compressed somewhere, for example, at the exit from the neck or from the upper aperture, when you try to reach somewhere, the body knows that the nerve can't lengthen and glide, but the muscles can. In fact, in such a situation, you could tear the nerve and the body, knowing that there could be a danger to the nerve. It will also activate muscle tone and simply won't let you stretch your arm like that, so you don't tear the nerve. And in fact, with nerve compression, we get both nerve irritation and muscle defense of a protective type. And you can very effectively relax this reflex spasm with the help of special neurodynamics exercises by Shacklock. We have several videos where we show special exercises to improve nerve gliding and to remove nerve gliding blockages. We have a video for the arm and even several videos for the leg, specifically for the sciatic nerve. And when you do nerve gliding exercises, it automatically relaxes all the muscles that were connected to this problem. If we are talking about relaxing central muscle tone, most often muscle relaxant drugs are used here, special medications that specifically affect the brain and try to relieve spasms through it. If this is not related to a stroke or cerebral palsy, but more to neurosensory amnesia, we can use special types of exercises, again, such as the Feldenkrais method or Thomas Hanna's method. Transcranial magnetic stimulation also works very well for this type of spasm when we use a focused magnetic field to stimulate the brain, and this is quite effective at relaxing the peripheral muscles. And let's summarize why I talked so much about muscle tone. If something starts hurting and you find a tense, painful muscle there, it doesn't necessarily mean anything. That it's a trigger point, or that you need to warm up this muscle, or that you need to take a pill for the tone. First of all, you need to figure it out, test it, and understand why this type of tone appeared, and work specifically on the cause of the tone. That's exactly why you should see a doctor, to figure out the cause and address the cause, not just the symptoms, already in the form of muscle tone. If you don't have the opportunity to see a doctor, you can try different ways to reduce muscle tone one by one, and one of them might work for you. This will happen when the method you use matches the actual cause of your problem. But it's much more effective if someone can tell you which type of treatment will be more reliable in dealing with your muscle tone. I wish you normal muscle tone and a great mood. See you. Bye, everyone. Subtitles created by